Let's consider a scenario for a moment. You're 71 years old, and honestly, you've never felt better. You started your morning with a walk, you're looking forward to dinner with your family, and you don't have a single ache or pain. You head into your doctor's office for a routine wellness visit, simply because it feels like the responsible thing to do. Your physician smiles and says, "You look fantastic, but given your age, let's run a few extra screenings, just to be thorough." Fast forward 1 month. You find yourself lying in a hospital bed, staring at the ceiling. It wasn't a disease that put you there. It was the decision to be safe. Those routine tests picked up a tiny shadow, a finding that never would have shortened your life or caused a single symptom. But it set a massive flywheel in motion. The test led to a procedure. The procedure led to an unforeseen complication. And suddenly, the active life you cherished feels like a distant memory. This is a reality many patients face when the medical system shifts into autopilot. Today, I want to walk you through 5 specific diagnostic screenings that I would strongly advise reconsidering once you cross the age of 65 or 70. We're going to talk about why the math of preventative medicine changes as we get older, and how looking for trouble can sometimes be the most dangerous thing you can do for your health. My name is Dr. Alexander Bennett, and this channel is dedicated to examining medicine through the lens of common sense and real-world data rather than just rigid protocols. What you're about to hear is the result of analyzing hundreds of clinical cases where an excessive focus on numbers ended up destroying a patient's actual quality of life. There is a critical truth that's hard to fit into a brief 15-minute primary care appointment. After the age of 65, the very concept of prevention needs to look different. We've been conditioned to believe that knowledge is always power. But in geriatric medicine, unnecessary knowledge often becomes a trap. We're going to take a close look at item number 3, a test that offers false hope to some and unjustified fear to others in 40% of cases. And I'll go into detail on number 5. This is a screening that people rarely talk about, yet it's responsible for thousands of cases of lost mobility in otherwise healthy individuals. Before we dive into the list, I want to ask one thing of you. Head down to the comments and share which medical test has caused you the most doubt or hesitation over the past year. Your honesty helps other members of this community feel more confident and empowered in the exam room. To help you understand why I'm so firm on this, I want to introduce a concept I call biological balance. When you're young, your body is a resilient, flexible system. If medicine intervenes, you bounce back to baseline quickly. But after 70, your health is more like a finely tuned scale. The extra weight of an aggressive screening or an unnecessary biopsy can permanently disrupt that balance. I call this the intervention funnel. It all starts with one harmless-looking lab result. That provides a reason for a scan. The scan demands an invasive follow-up. The follow-up leads to a side effect. And in the end, you find yourself battling the consequences of treating a disease you effectively didn't have. Keep that balance in mind. Now, let's move to the first item on our list, which causes the most debate in my practice. Checkup number 1, routine colonoscopy after age 75. Let's start with a procedure that many consider the gold standard of self-care, the colonoscopy. If you're 50, this screening can be a lifesaver.
Но когда вам исполняется 75, уравнение резко меняется.
And here's why. The issue isn't just the procedure itself. The real danger often lies in the stage that patients are rarely warned about, the preparation. For a younger body, 24 hours without food and an aggressive bowel cleanse is merely an inconvenience. But for someone in their 70s or 80s, it is a massive blow to the electrolyte balance and kidney function. Let me share the story of Arthur. He was 77 years old, the kind of person who never missed a doctor's appointment. He felt excellent until he decided to go through with a routine colonoscopy, simply because it was what the older protocols recommended. During the prep, due to sudden dehydration, he suffered a severe dizzy spell. He fell in the bathroom and sustained a hip fracture. The screening never even happened, but Arthur never walked without a cane again. He entered this process as a healthy man and left as a patient whose mobility was shattered before the doctor even turned on the monitor. The statistics tell a hard truth. Colon cancer typically takes 10 to 15 years to grow from a tiny polyp into a genuine threat. If you are 80, the statistical probability of that finding ever causing you harm is negligible compared to the immediate risks of the procedure itself. The risk of bowel perforation or serious bleeding is significantly higher in older adults. We are often risking immediate, severe harm to the body for a ghost of protection against a disease that might never manifest. Does this mean you should just give up? Not at all. It means you need to change the tool. If you have no symptoms, no pain, no sudden weight loss, or changes in bowel habits, talk to your doctor about non-invasive methods. For instance, modern stool-based DNA tests or annual FIT tests. These don't require an exhausting prep and carry no risk of ending up on an operating table due to a procedural error. Protecting your health isn't always about searching for problems at any cost. Sometimes it's about having the wisdom to say no to a procedure whose price is too high for your current well-being. And if a colonoscopy represents a risk of physical injury, the next item on my list is a test that keeps people in a state of unjustified fear for years, forcing them to take medications they simply do not need. The second item on my list is what we call overdiagnosis in the medical field. We're going to talk about searching for cancer in places where it doesn't need to be found. Specifically, PSA testing for men and routine mammography for women after the age of 75. It sounds counterintuitive, I know. We've been taught that early detection is always a victory. But after 70, biology begins to play by a different set of rules. The main issue with modern scanners and blood tests is that they've become too good. They detect microscopic changes that we refer to as sleeping cancer. These are tumors that grow so slowly that they would never have manifested during the remainder of your life. You simply would never have known they existed. But here is the trap. As soon as a test shows an abnormality, the machine starts running. A doctor can't just say, forget about it. It triggers biopsies, follow-up imaging, and eventually aggressive treatment. Take the example of Victor. At age 73, he had a PSA test done just to be safe. The results were slightly elevated. This led to a biopsy and then to surgery to remove his prostate. On paper, the surgery was a success. But Victor spent the rest of his life struggling with incontinence and a total loss of his physical health as a man. The bitterest part is that, according to research, his type of tumor would have grown for another 20 years without causing a single symptom. Victor traded his high-quality active old age for a clean blood test. He treated a disease that wouldn't have killed him, and in the process, he lost what made life worth living. For women, the situation is similar. After a certain age, the risk of a false positive mammogram and the subsequent unnecessary radiation or surgery becomes higher than the probability that the screening will actually extend your life. Your body at 75 is not the same as it was at 45. Tissues take longer to heal, and the side effects of therapy hit many times harder. If you have no symptoms, no lumps, no pain, no specific discharge, ask your doctor, if we find something, will it actually change my prognosis for the next 10 years, or are we just treating a piece of paper? Often, the answer will surprise you. But while sleeping cancer is a long-term risk, the next item is a checkup that can lead you to a panic attack and the unnecessary use of heavy medications as soon as tomorrow. We are moving on to the most controversial cardiac test. The third item on my list is perhaps the greatest trap in modern cardiology for those over 70. We are talking about routine treadmill stress tests, ordered just to check the heart, even when you have no chest pain or shortness of breath. Why do I call this a lottery? Because in older age, this test has a massive flaw. It is incredibly inaccurate. Research shows that in nearly 40% of cases, a stress test in an older adult flags an abnormality where none actually exists. We call this a false positive. But the consequences of that result are absolutely real. The moment the computer spits out an abnormality, your status as a healthy person is instantly revoked. The next step is a cardiac angiogram or catheterization. This is an invasive procedure where a tube is threaded through your artery directly to your heart. This is where the math becomes frightening. The risk of suffering a serious complication, a heart attack, or vessel damage during this checkup itself is often higher for a 75-year-old than the risk from the very problem they are trying to find. Let me introduce you to Leonard. At 74, he was an active grandfather who walked 2 miles every single morning. During a routine visit, his doctor suggested a stress test. The test showed a questionable result. Leonard was sent in for a stent. During the procedure, a small bleed occurred that required a long recovery. To keep the stent from clogging, he was prescribed powerful anticoagulants, blood thinners. 2 months later, because of these pills, he suffered internal bleeding. Leonard survived, but he no longer walks his 2 miles. His biological balance was destroyed by a procedure he didn't need, especially since he was already handling his physical activity perfectly well. Major studies, such as the ischemia trial, have proven that for stable patients without acute symptoms, aggressive procedures like stents and bypass surgery do not extend life any better than high-quality medication and a healthy lifestyle alone. But in a cardiologist's office, you rarely hear that truth. If you can walk up 2 flights of stairs without chest pain or severe shortness of breath, your heart is passing a, quote, natural stress test every day. Don't let a paper report drag you into a funnel of procedures that will take more from you than they give. But while the heart is a matter of survival, the next point concerns your very foundation. We will discuss a diagnosis that promises to save your bones, but often leads to them breaking even faster. Item number 4 on my list concerns what many consider the foundation of safety in older age, the strength of your bones. We're going to talk about bone density scanning, or DEXA scans, and how this test frequently leads to treatment that actually makes the situation worse. The problem isn't the scan itself, but what happens afterward. After age 70, everyone's bones become less dense. That's natural biology, not a disease. However, the system is calibrated so that any deviation from the bone density of a 25-year-old is labeled as osteoporosis. And just like that, you are prescribed bisphosphonates, heavy-duty drugs designed to strengthen bone. And here lies the trap. These medications work by slowing down the natural turnover process of bone tissue. Yes, the bone appears denser on an X-ray, but it becomes more brittle in reality. It loses its natural flexibility. Take the story of Margaret. At 76, she had a scan, was told her bones were like glass, and was put on medication. Margaret took them for 5 years, pleased with the good results on paper. But one day, she was simply stepping down from her porch, and her femur snapped under her own body weight. This is what we call an atypical femoral fracture. The medication intended to strengthen the bone made it unable to withstand ordinary, everyday stress. Margaret treated the numbers on a page, and in the end, she lost her ability to walk. What do I advise my patients? Instead of focusing solely on bone density images, focus on not falling. Balance training, Tai Chi, strength exercises, and even simple things like checking the lighting in your home protect you from fractures far more effectively than aggressive drugs with questionable long-term benefits. But while fracture risk is a matter of mobility, our final point is a matter of brain survival. We are moving on to a screening that surgeons often call a routine cleanup, but which carries the risk of the most devastating outcome for any active individual. We've reached the 5th item on our list. This is perhaps the most dangerous screening I'm discussing today because it is marketed under the guise of stroke prevention. I'm talking about carotid artery ultrasounds for individuals who have no symptoms whatsoever. The logic seems straightforward. A doctor finds a small plaque in a neck vessel and says, "Let's clean this out so you don't have a stroke." It sounds perfectly logical. But here's what they don't tell you. If you have no symptoms, no vision issues, no speech difficulties or sudden weakness, the risk that the cleanup surgery itself will trigger a stroke right on the operating table is about 3%. For someone over 75, that is an enormous risk. The chance of suffering a stroke from the surgical intervention is often higher than the chance that the plaque would ever move on its own. We are attempting to fix something that isn't broken using methods that are themselves a threat. Consider the story of James. At 79, he was full of life, driving his own car and staying active with volunteer work. An ultrasound showed a 70% blockage in his artery. He had no symptoms, but the surgeon convinced him it was a, quote, ticking time bomb. James agreed to the procedure. During the surgery, a tiny fragment of the plaque broke off and traveled to his brain. James survived, but he can no longer drive, and he struggles to recognize the faces of his loved ones. His ticking time bomb only exploded because a surgeon decided to defuse it. Remember, in modern medicine, for patients without symptoms, conservative management, controlling blood pressure, blood sugar, and cholesterol is almost always safer and more effective than trying to clear the pipes with a scalpel. Everything I've shared today comes down to one core idea. After age 70, your goal shouldn't be perfect lab results. Your goal is to preserve your life exactly as it is right now, independent, energetic, and meaningful. You have every right to ask your doctor, what happens if we do nothing? Sometimes, doing nothing is the most difficult and the wisest decision of all, requiring much more courage than simply ordering another test. If this video has helped you look at your health from a different perspective, please subscribe to the channel. We are here to help you take back control of your life. And be sure to leave a comment below. Have you ever been offered a test that felt unnecessary to you? Your story might help someone else make the right decision. Take care of yourselves. I'll see you in the next one.